Richard, without further ado, can I ask you to explain what the STP is and what the STP can do for you?
So, what is the vision for healthcare under the transformation programme across Hampshire and the Isle of Wight? Well, in essence, it's the vision that you, the governing body, and you, the local citizens of Fareham and Gosport, have signalled you want to achieve for the local population. We want to support people through prevention, early intervention and empowerment to live longer in better health, which is a fundamental aspiration for our governing body and for you as local citizens. We want to tackle the issues which are causing concern, unsafe services and poor quality and experience of services. And the STP will help that by creating standardised operating processes across the board. We want to help you as citizens and us as clinicians and officers to allow you to control your own health and your information. And we're investing in significant amounts of digital infrastructure that will allow you, given whatever condition you have, to own your condition, own your records, and if that's what you would want to do, really empower you to manage your health as you move forward. We want to reduce the amount of time, the burden of care of people travelling to and fro, basically be told they're either okay or there was no need for you to come, everything's fine. So bringing care really close to home, even through the digital channels into your home. And finally, we want to be far more precise about predicting who will be falling ill and how can we support people in living independently before people fall ill. And I will leave you with a final thought in that there's a huge amount of discussion and debate we're having now around understanding the outcomes that people want to have around end of life, which is a fundamentally important conversation. When we have conversations with people before they fall very ill, they talk about wanting to be cared for but not but they wouldn't want to be cared for if they're unable to, they wouldn't want extreme care if they're not able to understand their local relatives, they're not able to have cognizance, they're not able to have any form of quality of life. And yet we wait for those conversations when people are critically ill. Our job, and one of our jobs, is to have the conversations and empower people to control their health throughout their whole lifetime, including end of life. So that's a flavour, David, of the journey we're on as a transformation programme. But again, I'd really welcome questions and comments and observations.